I'm Dr. Marty Bergman. I'm a rheumatologist in Delaware County at Taylor Hospital. I'm Chief of Rheumatology at Taylor Hospital, and I'm Clinical Associate Professor of Medicine in Rheumatology at Hahnemann, now Drexel University College of Medicine.
My name is Kitty, and I have rheumatoid arthritis.
My name is Suzanne, and I have Sjogren's and lupus.
Having Dr. Bergman as my physician has been a wonderful experience with a horrible disease. Having someone like him on my side has always made me feel like I'm not alone. And at my worst time, he says, we can make it through this. We can do this together.
Having Dr. Bergman as my physician and my rheumatologist has been, actually I guess rewarding might be a good word. I've been sick for about 6 years. And I try not to be. I try and pretend I'm not most of the time. And being able to have somebody who can tell you you're not crazy, that it's not in your head, and can validate that you're actually feeling the way you are, but can also tell you that it's going to get better and be realistic, makes it so much more tolerable. And knowing that he has lots of patients, and we probably all have the same complaints. He treats me every time like it's new and fresh, and it's never something old for him. So that it just makes it that much easier to deal with.
The biggest thing I've learned from my patients is how they are able to cope with having a disease. And they just keep on living their life. They don't let it get in their way. And that's a lesson I think is important for all of us to learn, that you'll deal with it, you move ahead, you take care of it, you don't ignore it, but you don't let the disease dominate your life. You sort of take control of it, and that's an important lesson.
I would make a list when I went in. I would have a list of questions that I wanted answered, and I would make sure that when I went in, I had that list there. I don't whip it out at the end, but go in with that list and say, I want to make sure I get these are the answers that I need before I leave here. And when you go in, make sure the physician knows that you have this list of questions up front so you can spend the time going over them. And I think having regular appointments, I know I do better when I have regular 3-month appointments, 4-month appointments, not sort of once a year checking in.
I think the best thing you can do as an arthritis patient, when you go to your physician, be as honest as you can be. Tell him exactly how you feel. The best thing you can do is leave the excuses at the door. Just try to be as honest as you can and let him filter through it. Just tell him the truth as you see it.
The best way a patient can take care of themselves and be the best patient they can is to try to be as informed as possible about what's going on, what their disease is, what the disease isn't, what the medications they're taking are for and what they're not for, and how to best take them. Right now we're in a very exciting period of time in rheumatology. There's been an explosion of new medications and new science to understand how the medications work and how the diseases work. On top of that, we now have new ideas for imaging. Before it used to be just x-rays, and then it went to MRI, and now ultrasound is becoming very popular in the United States. And ultrasound is a fun tool. It's right at you. You see it, you put it on the patient's wrist, you see the disease going on. It's very easy for you to conceptualize what's going on. It's also very easy for the patient to conceptualize what's going on. And I think the other big difference is outcomes. Because of the new medications we have, and because of our ability to make diagnosis early and to stop disease activity early, we're able to make major differences in patients' life. So we no longer have the deformities and the disabilities that we used to have to accept. We're now at a point where we're stopping disease, and that, for me, is the most exciting part.